Hello and welcome. My name is Dr. James R. Fetish, DC. I'm the clinic director and owner at Village Family Clinic. We're Northwest New Jersey's leading provider of healthcare, multi-specialty healthcare. We're located off exit 19, Route 80, less than 2 miles off the exit in Hackettstown, New Jersey, right next to Alamucci. In our 4,000 square foot facility, we have multiple services available, including chiropractic, medical doctor on staff, medical pain management, acupuncture, physical therapy. We're certified in DOT and CDL physicals, as well as drug and alcohol testing and many other services. We're a total healthcare provider. We hope to answer some of your commonly asked questions about healthcare inside the office today. Come with me.
It is very important to incorporate massage into your wellness plan. At Village Family Clinic, we offer a very affordable massage program with a plan designated just for you. Everyone has a different body and no massage should ever be the same. Massage at Village Family Clinic is different because your chiropractor and your massage therapist can work alongside each other, and it's about therapeutic healing, rehabilitation, and overall relaxation. With life's aches, pains, and stresses, massage is beneficial no matter what your body's concern is.
It's been amazing. I'm a cancer survivor, so I've dealt with a lot of issues through my life. Long-term effects from chemotherapy, fatigue, I get a lot of muscle aches, so acupuncture has been incredible for me. I have more energy. I've always been into different modalities of healing, and I think the best thing about it is that it's complementary to any other treatments that you may do. So, you know, whatever, it works in accordance with everything. Herbal medicine, acupuncture, and the approach here, it's about the whole person. You know, it's not just about, you know, seeing you as everything is taken into account. Your lifestyle, diet, all of it. You're not just seen as a statistic, or the entire person is taken into account, which is really important, especially in our culture today.
Dr. James Fetish, Clinical Director and owner at Village Family Clinic. We get a lot of questions about a lot of different conditions. One of the most common conditions we get asked about these days is carpal tunnel syndrome. So, big study everyone's been talking about the last 2 years is sitting is the new smoking. We're all sitting at desks all day long, typing on computers, on the internet all night, and sitting is causing more health problems than smoking used to in the 50s and 60s before we knew what that was doing to us. So people are sitting at their keyboards typing all day like this, and unfortunately the keyboard's in an improper position like this a lot of times, which can irritate the carpal tunnel. So a lot of people heard carpal tunnel. It's probably the most misdiagnosed thing that we see in here. People think anytime there's hand pain they have carpal tunnel syndrome, or anytime there's any kind of numbness or tingling in the lower part of the arm that they have carpal tunnel. Not necessarily the case, so a proper diagnosis is very important. A lot of times numbness in the hand can come from the elbow, shoulders, or neck, so it's important to rule that out. That's something we can do here. But typically carpal tunnel is going to be numbness just in this half of the hand. We're going to have these two fingers and the thumb. It's because the median nerve is the main nerve that runs through the carpal tunnel here and goes off into this side only of the hand. So any numbness or tingling on these two fingers cannot be carpal tunnel syndrome. There's other syndromes similar, but carpal tunnel is kind of the buzzword. So that's the first important thing. One way to test at home, if you might have carpal tunnel, is the old prayer test, we call it. We just hold our hands like this for about 30 seconds. What that does is put a little stretch on the carpal tunnel. If you start getting tingling in these three fingers, there's a good chance that you have carpal tunnel. But it is important to get evaluated by a qualified doctor. You can have nerve issues in the elbow, the shoulder, or neck causing it as well. When you zoom in on our little friend here, the reason why we have carpal tunnel problems, we got the two bones of the forearm here, and going into the wrist, these carpal bones are the wrist bones. The wrist is made up of 8 small bones, and through this tunnel right here, you can see on here, pass a bunch of nerves and tendons that control all the fingers. So when you actually move your fingers, the tendons you feel all the way up in the forearm are actually what's moving. So those muscles have tendons that run all the way through that tunnel, all the way to the top of the fingers. So in through here, there's a tendon for each finger, a couple nerves running through, and it's a pretty small area. When we end up typing or putting our wrist in this position for hours and hours in a day, that nerve can get swollen or irritated in there. That's what we call carpal tunnel syndrome. Speaking of the nerves and tendons, it's kind of hard to show on Mr. Skeleton here. You can see all the tendons and nerves running through that small space, and over top there's this retinaculum which can hold that in position and allows these nerves to pass through with some protection in there. And again, they get inflamed, causes carpal tunnel syndrome. There's a lot of different ways to treat it. The most advanced, newest way that we're doing here at the clinic is cold laser therapy. So Dr. Oz has called cold laser the no-pill pain buster. The reason is it just gets rid of all sorts of pain and inflammation, but carpal tunnel is one of the first areas that we were doing cold laser on. It's been FDA approved for over 10 years. This is our cold laser device here at the office. ML830 is one of the first FDA-approved lasers. And what it does, instead of sends a light wave through the end of this probe, which gets rid of the inflammation and swelling of those nerves. We used to ultrasound these problems, which we still do, and we do have ultrasound therapy, multiple machines here in the office. But the laser gets a deeper penetration. Ultrasound maximum penetration is about 1.5 centimeters to 2 on the most. Laser goes 5 centimeters, which is over double where the ultrasound is going to get. It's also painless. You don't feel a cold laser, and there's no messy gel or cleanup. If anyone's ever had ultrasound at home, that can be quite a messy experience. So we can demonstrate the laser. All we do is point the laser over the carpal tunnel, and we'll turn it on. You will be able to see a little bit of light as it's coming out. Mostly you do put it skin on skin so you wouldn't see it, but just for demonstration. And over a series of cycles here, we'll just take a few minutes, we'll be able to get rid of that inflammation of the carpal tunnel and get rid of that nerve pain for you. A couple of other things we'll typically do for carpal tunnel is B vitamins are known to speed the healing of nerves. So even if we get the inflammation out of the nerves with the laser therapy, we can still sometimes have some issues. So I recommend a good B complex for most patients. And a lot of carpal tunnel patients will have a lot of difficulty at night sleeping. Their hands will go numb while they're sleeping. So that we'll curl our wrists or do some funny sleeping pattern which puts pressure on those nerves while we're sleeping. So a carpal tunnel brace is sometimes recommended if we're having a lot of night pain. And those you can buy at any local pharmacy. There'll be a little hard brace that'll kind of hold the wrist in this position to allow that tunnel to be open through there and allow those nerves to heal up for you. But it's commonly misdiagnosed. It's important to diagnose the carpal tunnel properly, and once it's diagnosed properly, it is a pretty quick treatment. It's something that we treat every day here in the clinic. Thank you.
Honestly suffer from at least 3 debilitating diseases that cause a lot of pain: Parkinson's, spinal stenosis, and fibromyalgia. And I come here twice a week now for the last 9 months for about an hour and a half. I get spinal decompressions, chiropractic, and then I end with acupuncture. And I walk out of here totally pain-free. I mean, it gives me such relief in my life that it's the best medicine ever.
One of the other most common questions we get here at the clinic is about disc herniations and disc bulges. There's a lot of misunderstandings. There's a lot of fancy vernacular regarding these issues. Hopefully explain these things a little bit better and some of the options available to you. Very common problem to have a disc bulge or herniation. We estimate about 15% of the people have one and don't even know it. So the disc can bulge or herniate before they even cause pain. And on top of that, there's many people suffering with disc pain. So it's a pretty common issue. A little anatomy lesson. This is our lower back here, and our back, between our neck and our back, we have 26 bones of vertebrae. Lower back, there's 5. We can just number them, L1, L2, 3, 4, and 5. And down here's your kind of sacrum going into your pelvis. The discs are the spacers in between the bones of vertebrae. They really do 2 things for us. They space these bones apart, and they're our body's natural shock absorber. So when we're bouncing around and doing all this stuff during the day, exercising, it absorbs that shock. The other important goal of them is to space these vertebrae apart. So you can see how these nerves exit in between each set of vertebrae. These nerves go down to different areas. In the neck, the majority of the nerves go down into the arms, and the lower back, the majority go down to the legs. So most people have heard of sciatica, when patients are having leg pain in the back of their leg. Typically that's looking at something in the back, pinching or irritating the nerve, shooting down into the leg. So when these discs are nice and smooth, everybody's happy, everything's working well. And we take a little zoomed in look at the top of this disc here, and explain a little bit more what a disc looks like. So I explain to my patients that discs look like jelly donuts. There's a nice fiber that holds everything together, and inside there's some soft liquid. And if we look at the disc here, this part's the fibers that hold everything together, and this part here is kind of like the jello inside that absorbs the shock. And that's a good system working out. What can happen with these discs is over time, they get worn out, those fibers start tearing on the outside, and they can bulge or herniate. And there is a difference between the two. Some people use the words interchangeably. They're not exactly the same thing. What a disc bulge means is that jelly donut's still all together, it's just pushing out a little bit. So the outside of the donut's still intact, it's just pushed out a little bit. What a herniation technically means, those fibers have torn and some of that jelly is now coming out of the disc. But one doesn't necessarily be more serious than the other. Typically herniations are a little more serious than bulges, but not necessarily. And what that'll look like is this model here. We got the nice disc here, and we can see this piece coming out where it's not supposed to be. You see on the other side is normal, everybody's happy, big space in there from the vertebrae. Over here where that disc is bulging out, it could be compressing or putting pressure on that nerve. So the interesting part about the disc, it's the only part of the human body with no nerve supply and no blood supply. So what that means is you don't actually feel the disc. So if someone says you have disc pain, they typically don't have disc pain, it's the disc is rubbing a nerve or something else causing pain, because you can't actually feel the disc. The other interesting part is there's no blood supply to a disc. So for example, when you cut your skin, blood flows there and it heals up. Everybody can kind of understand that. But if you cut a disc, it will not heal on its own because it doesn't have a natural blood supply. The way it does heal is by movement. The discs move and the fluids pump in and out and they're able to heal. But when the disc is herniated or injured, it doesn't tend to heal on its own. So there's several treatments available to that. Chiropractic, physical therapy, acupuncture for the minor disc can handle the pain and sometimes relieve some of the symptoms. However, when there really is a nice bulge putting pressure on the nerve, massage, acupuncture therapy, all that stuff helps the muscles relieve some of the pain. But ultimately, if that disc piece is still putting pressure on the nerve, we're going to have some symptoms. So the more moderate to severe discs need a little bit more than that. What we do here at the clinic, these two giant tables behind us are spinal decompression devices. We have 2 of them here. State-of-the-art FDA-approved technology to relieve disc bulges. And what the machine technically does is it tractions or stretches open the spine in order to suck a piece of that disc back in. So the disc is out when they come in, you traction the spine and the disc can get sucked in a little bit. We tell patients they're not going to look back to normal, they're not going to be 100% typically, but if it's pushed out 3 millimeters, if we can suck it in 1.5, 1 millimeter, just enough to pull off the nerve, there'll be no more pain. So if the traction device is able to do that, we'll feel a lot better. The big advance with these tables, years ago we'd put you in the hospital into traction. You'd sit on the traction table for a whole day pulling on the spine. We found out the spine doesn't really like being pulled for 8 hours at a time. So what the decompression does is slowly pull, holds for a period of time, releases some of that pressure, and pulls in cycles. That allows your body to break. It also helps pump the fluid in there, and it can help heal or regenerate that disc to some degree. So it's a great alternative for you. Other alternatives available are epidural injections, where they do a cortisone steroid injection into the nerve to calm it down. And of course, in real drastic cases, you do need surgery. And that's pretty rare, but it certainly happens that disc is bad enough they'll need to surgically go in there and take it out. But obviously, it's a very delicate area. We want to try to avoid surgery if we can at all costs. Hope that answered your question about discs.
Not only here at Village Family Clinic, we will provide you with physical entities for your well-being, but we can provide various testing such as DOT physicals and non-DOT physicals. I'm certified to be doing drug alcohol testing and urine specimens. So I'm going to go ahead and perform that on Ashley so you can kind of see the rundown of it. Okay. I'm going to provide an air bank. Shows you that there's no ambient alcohol in the air. You're going to blow as long and as steadily as you can, not necessarily as hard as you can. Keep going. Halfway there. Keep blowing, keep blowing, keep blowing. There we go, great. 0 BAC. If you have any questions about DOT or non-DOT, drug or alcohol testing or screening, you can go ahead and visit our website or give us a call and we'd be happy to answer any of your questions.
One of the other common questions we get here at the clinic is about plantar fasciitis, or heel spurs is another name for it. Another very common condition. This year in the football, we saw Peyton Manning miss 5 weeks for a plantar fasciitis. So it can be pretty debilitating. There's varying degrees of it, but we can explain it and some of the procedures that we can use to help it out. So on the bottom of the foot, there's a bunch of bones in the bottom of your foot. We should have a nice arch to the foot. We can kind of see through here how we have a nice arch. Underneath these bones is something called the plantar fascia, and that's where the plantar fasciitis comes from. And it's just a band of tissues underneath the bones that kind of hold that arch up in place. So with everything's working well, it works just like my hand here. We have a nice arch on the inside of the foot, and that plantar fascia is underneath there. Unfortunately, what happens with modern society is that we're wearing these poor shoes all the time, and over time that arch starts flattening out. That plantar fascia is only so long in between there, and it gets stretched and pulled, eventually getting inflamed, and that's the itis part. So that's our secret medical word. It means inflammation, and what happens, that plantar fascia gets inflamed. So there's usually pretty simple fixes for it. Typically we get rid of the inflammation. 2 common ways will be the cold laser or ultrasound therapy can usually get rid of the inflammation. We give home exercises. A good trick at home is to roll a golf ball in the bottom of your foot for a few minutes at a time to loosen that plantar fascia. Also, if it's very inflamed, we recommend patients take a water bottle, fill it up with some water, just throw it in the freezer for a while, get it nice and cold. When you get home from a long day at work, we're going to roll up and down on there, and that'll calm that inflammation down. Those are some of the best tips, and again, in the office, ultrasound therapy, those types of things. And one of the best things to do is just get some orthotics or supports. If that arch is really fallen, we need some supports to hold it upright. And unfortunately, a lot of shoes that patients and people are wearing these days don't have the support they used to. So a lot of times we have to get supports. But one of the ways we can evaluate plantar fascia is that we have a 3D laser scanner that's able to scan your feet, take measurements of the arches, how high they are, how much weight's on them, how much weight you're putting on your right foot versus your left. Some people, such as myself, have one leg longer than the other. If we're walking around crooked on those feet all day, that's going to cause a lot of issues as well. So one of the only clinics around that has a 3D laser assessment, which we're going to demonstrate for you now.
Acupuncture has been around since ancient China. Japanese, Koreans, they all have their own style of needling. I'm not going to tell you which one came first because I don't want anyone to fight over it. Acupuncture needles are placed into the body about 1 inch or 2. I like it better than deep tissue massage because I think the problems are more focused. It goes deeper and more specific into the anatomy. It's meant to redirect energy in the body. It's used for a host of problems from sinus conditions, back pain, neck pain, all sorts of joint pain, arthritis, even many autoimmune disorders like lupus, thyroiditis. As this patient also has fibromyalgia and Parkinson's, she seems to get relief from the needles. Sometimes with the needles I attach electric stim. It gives more stimulation for the muscles and the nerves. I also use an infrared heat lamp with my treatments because the heat and energy shine below the skin and muscle surface. I'm going to demonstrate how simple it is. Many people are afraid of needles, but they're more like tiny pins, very like hair thin. All the needles are used only one time. They're disposable. You palpate the skin surface to find exactly where to put the needle. Marie, is there any pain?
None at all.
Sometimes you'll feel the pinch of the needle, especially if it gets close to a nerve, but sometimes that could be good for the extra stimulation and blood flow. Everything all right?
Yep.
Currently, acupuncture is being offered at this clinic on Tuesdays and Fridays all day from 10 to 7. Again, my name is Andrew. You could contact the lovely ladies at the front desk. They'll be happy to make an appointment with you. Initially, you could expect to see the acupuncturist as well as the chiropractor 2 to 3 times a week until the symptoms subside, and you could be on once-a-week treatment. Thank you.
One of the more frequent questions we get asked now is about text neck. So back years ago, we used to just call it bad posture. Now with iPads, iPhones, everyone's walking around like this all day, and they're calling that text neck. And how can that affect your body, and what can we do about it? It's a pretty important problem, and we used to see bad posture as people got older, and now we see it younger and younger with the first generations growing up with iPads and iPhones. So a little explanation, when we look at the spine from the side, we have curves to our spine. So lower back curves in, middle back curves this way, and neck curves back, and that's how we stand up nice and straight. When you look at the spine from the back, we want it to be nice and straight. To the side is a scoliosis, which isn't a good thing, and that's something else that we can help with. But from the side, we should have nice curves, kind of like this model here. When we're sitting looking at iPhones and iPads all day like this, what happens at the front of the neck is that it starts getting flattened out, that curve there. And what that does is put a lot of extra pressure on the back of the neck. So one of the ways we're able to assess this here is we have a digital postural assessment program. What we do is take pictures of you, and we're able to analyze your posture after we're done. So this is an example of one of the staff here. We can see we take a front view. We want to see if everything's in a nice alignment, shoulders, hips, chest. eyes. This is a way we can evaluate your alignment without x-rays anymore. And on the bottom view is the lateral or side view where we can see those curves we were talking about. So we got the ankles, knees, hips, shoulders, and ears should be in good alignment. We can see on this staff member that her ear is out quite a bit from that front line. So it shifted about 1.2 inches, which doesn't sound like a lot. Her head weighs, according to the software, we're at a little over 10 pounds, 10.9 pounds. When we shift that neck forward to 1.2 inches all day, she's effectively carrying around a 24-pound head all day. That's too much stress for someone that size to carry around all day, and it can cause neck pain and headaches. So what that'll look like here, if we take our model again, the curves are all nice and steady. We can put a lot of pressure on that, and that's pretty steady, and that's gravity pushing down on you all day. But if we have that neck bending forward and you put straight pressure on it, we can see what will happen to the spine. It puts a lot of undue pressure back here, so it tends to cause a lot of neck pains, headaches, different symptoms up in that area of the spine with this bad posture. So chiropractic care to get the alignment better is a great method. And after that, doing some rehab physical therapy exercises to help strengthen those upper back muscles to hold us upright. Because unfortunately, most of our daily lives we're leaning forward all day. And it's important to have good posture for our health and breathing. That's just one more problem we're seeing in modern society. We call it tech snack. Thank you. Thank you for coming along with me on a tour in our office here at Village Family Clinic. Hope you learned some information and answered some of your most commonly asked questions. If we can be any service to you, or if you have any questions or further information, you can give us a call anytime, 908-813-8200. You can also find out more online at hackettstownfamilyclinic.com. We're open 5 days a week, Monday through Friday, 9 through 7. Our services include chiropractic, physical therapy, acupuncture, medical pain management, massage therapy, DOT physicals, drug and alcohol testing, and much more. So if we can be in any service, please let us know. We're right off exit 19 off Route 80 on Route 517, Hackettstown, New Jersey. Again, the phone number is 908-813-8200 or online at hackettstownfamilyclinic.com. Thank you.